Hello, and welcome back. I'm Leggy Ballesteros, a PA from Gonzalo Medical Group in San Antonio, Texas. Thanks for joining me for this video on pharmacotherapy options for our patients with obesity. We're going to identify and discuss indications and uses that are currently approved medications that target GLP-1. Notice I said currently, which is as of May 2026. This field is moving fast, which is exciting, but it can be hard to keep up. In this video, we are discussing the FDA-approved formulations for these medications, not compounded medications, as compounded medications have not undergone extensive clinical trials and evaluation, nor are they FDA-approved. We're going to cover a lot of ground in this video, so let's dive in. Currently, there are 4 molecules approved by the FDA that target GLP-1 for the treatment of obesity: liraglutide, semaglutide, tirzepatide, and norepinephrine. You may also hear this class of drugs referred to as incretin-based therapies, incretin mimetics, and nutrient-stimulated hormone therapies. They work centrally and peripherally to reduce appetite, improve insulin sensitivity, and slow gastric emptying. These medications have demonstrated a significant reduction in body weight. In 2014, GLP-1s began to hit the market with the introduction of liraglutide. It is injected once daily, in contrast to the newer injectable therapies, which are taken once a week. We see an average reduction of about 10% range with this medication. Semaglutide was approved in 2021 for the treatment of obesity, and its label has been expanded multiple times since then. There are more details in the prescribing information, so I always recommend reading through it. But semaglutide is approved to reduce body weight and maintain weight reduction in patients ages 12 and older with obesity, and in adults with overweight and at least one comorbidity. It's also approved to reduce the risk of major adverse cardiovascular events in adults with obesity or overweight. These 2 indications apply to the injection, and the oral formulation can also be used for these 2 conditions, but only in adults. The injection also is approved for the treatment of metabolic dysfunction-associated steatohepatitis, or MASH, in adults. Semaglutide is available both as an injection and as an oral medication. Dose escalation with the injectable formulation starts at a 0.25 milligram weekly and maxes out to a new dose of 7.2 milligrams weekly. Although most are able to achieve weight reduction and maintain their achieved weight loss at a lower weekly dose. With injectable semaglutide at 2.4 milligram dose, we saw an average reduction of body weight around 15% in the STEP clinical trial program, and this increased to 19% with the 7.2 milligram dose. The tablets, which became available in January of 2026, start at 1.5 milligrams daily and max out at 25 milligrams. With oral formulation, the average weight reduction was 14% in the OASIS 4 trial. Okay, let's move on to tirzepatide, which was originally approved in 2022. This medication targets both GLP-1 and GIP, another incretin, which also regulates energy metabolism, fat storage, and plays an important role in managing blood glucose. Tirzepatide has 2 indications. It's approved to reduce weight and maintain weight reduction in patients over the age of 18 with obesity or with overweight and at least one comorbidity. It's also approved to treat moderate to severe sleep apnea in adults with obesity, but it is only available in injectable formulation. Similar to semaglutide, dose escalation is recommended to reach the optimal results. It starts at a 2.5 milligram weekly and incrementally increases to a maximum dosage of a 15 milligram per week. With tirzepatide, we see a weight reduction in the 20 to 25 range at the maximum dose. Note that both tirzepatide and semaglutide were both originally approved for the treatment of diabetes type 2 under different brand names, and semaglutide has different dosages for type 2 diabetes. Finally, let's talk about orforglipron. This oral medication was approved in April 2026 to reduce excess body weight in adults with obesity, as well as adults with overweight and at least one weight-related comorbidity. As with the other medications, dose titration is an important part in reaching the maximum treatment goals, with dosages starting at 0.8 milligrams per day and a maximum dose of a 17.2 milligrams per day. With orforglipron, we see a mean weight reduction of approximately 11% in the maximum dose in its clinical trial. These medications share some important similarities, one of which is that not every patient will need to do that maximum dose to achieve their treatment goals. They also share their most common side effects, which are GI related, and the majority of their contraindications, warning, and precautions. In another video, I'll share some information with you about how I educate my patients to mitigate some of these potential side effects associated with the drug class. Tune into my next video where we'll discuss some ways to individualize treatment.